Welcome to the Care Shift. I'm Norman McCullough, and today I have the privilege of sitting down with Sridhar Uyyala, founder and CEO of TensorLinks. Sridhar has spent years as a research scientist at Intel. He holds 3 U.S. patents and made the deliberate move into healthcare AI at the moment when most people are still arguing about whether it belongs there. The result is TensorLinks, an agentic AI platform already deployed across more than 100 dental practices and DSOs handling over 2.2 million patient interactions every month. Sridhar, welcome to the Care Shift.
Thank you, Norman, for the kind introduction. I'm happy to be here.
Excellent. And we're very happy to have you. So you went from Intel, from Intel research scientist, patents, deep technical work, to founding a company squarely in the dental and healthcare space. Walk me through that. What was the moment where you said, this is the problem I want to spend the next decade on?
I wouldn't say it is linear. It is actually a shift, quite a bit of a shift. I just had the idea that, I was working on some of the latest technologies while at Intel Labs, like the virtual reality and some of the deep learning, computer vision. I could see and self-driving is one of my biggest interest around that time, along with virtual reality. And I thought the self-driving cars would be here. If so, what would I build for that future? It felt like an easy thing would be to just build an assistant that you can interact with the cars while you're at it, right? Getting entertained, getting information, right? I was already imagining an agent and an assistant for you on the go instead of being at home, right? I was too early. I predicted too fast. So I left the company to build, I actually left the Intel Labs to build TensorLinks, mainly as an assistant for the cars. But the voice stack wasn't there, the LLMs were not there. So the interactions weren't great when I tried the prototype. So I had to go back to consulting, which I chose the CVS Health, which gave me like a health tangent where I was digitizing the patient engagement. That's kind of my segue into healthcare. But when I saw the LLM breakthroughs like a GPT-2, GPT-3, then I realized, okay, maybe the interactions would come now. So that's how I started experimenting with a lot of products. Realized the large language models would be great at orchestrating some of the workflows. Maybe healthcare would be a good one. That's how I asked in my network a friend of mine to introduce anyone in his circle if he knows any of the healthcare clinics where I can take a look at their operations. And that's how I got into it. I met a dental clinic owner who has like an operations manager who has like 9 clinics at the time. And I listened to the operations and the burdens that they had. I felt like a click. Maybe I could solve some of these with the front desk AI. It wasn't immediate that it would be a front desk AI, but it felt like something with the voice, something with the text, very intriguing, and started to like barge into it and realize that it can be like a platform that can do a lot of workflow administration, orchestration, reducing the burden. So that was kind of how I got from cars to healthcare.
I understand. Well, thank you for sharing that. Absolutely. So you're pretty deliberate about the word agentic. You don't call TensorLinks a chatbot company or an automation platform. What's the actual distinction, and why does it matter for a dental practice owner trying to make sense of what's out there?
It is a perspective or the lens that we look at, right? I could simply say, hey, we are building a chatbot or a voice assistant that's going to take calls, right? And in a different way, you can say a receptionist. People know that just take calls. But we're holistically thinking, like, how do we manage the operations at a dental clinic, right? And what that means, there will be various staff. Like if you have an office, take a typical dental clinic. You will have a receptionist, you will have an office manager, and you will have a dentist, hygienist, other staff members, right, that are running the clinic. If you take a small clinic, right, a 1 or 2 chair clinic. Right. But most of the time, the staff is like handling a lot of administrative work, wearing multiple hats. Office managers might be taking calls and looking at the schedules, looking at the production, and checking with the patients, following up with the patients, and they would do a lot of administrative work. And imagining now, like taking that lens and the perspective into picture, how do I like automate those workflows so that we can reduce the burdens and obviously increase the efficiency and provide access to the care immediately. Like if a patient wants to get the care, that should be easy. And that's the lens we look at, and we say we are automating a lot of these workflows, and that's the word for the agent. The agent that's going to come in, an assistant that's going to come in, help you to manage these workflows. So we're literally building an agent that's going to do these chores. So we don't look at like the voice or the SMS, web, these are all just channels. Like imagine like you have a receptionist that would need to talk to in English, or they need to answer the calls on the phone, or they would need to communicate on the SMS, or they would answer the calls on the website, or they're checking their emails. Those are just the tasks or the communication channels. Our AI is similar. It is actually checking all of these channels. So that's why we don't call voice bot. We don't just call SMS bot. We just call an assistant that's help you run the clinic operations.
Understand. So, there's a stat on your site that stopped me. It said 35% of dental practices go unanswered. Patient calls go unanswered, and 68% of calls who reach voicemail never call back. Where did that insight come from, and how did you become the North Star for what you built?
Yeah, sure. I mean, it wasn't, see, I'm an outsider. As you know, like I want to build an assistant for the cars. But when I worked with the DSO as 9 clinics, right, how they manage the calls, how they like log into different practice management systems, right, and use the apps like voice over IP apps to manage the calls at multiple clinics. And when we look at the data, like the initial product was to get insights into the operations, not like automate it. How do we get the insights on the call management or operations so that they can go back and run efficiently? That insights that we built actually exactly gave rise to those metrics or KPIs to say, oh, like we have a lot of missed calls here, like 38 to 36% of the calls go missed at a single clinic, if it is a busy clinic. And the missed calls means missed revenue, missed care for the patients. So everything around that makes sense. Okay, if most of the calls are around scheduling and patient engagement or like getting the access to the care, why not AI handle some of those like scheduling operations, right? So that's kind of how we started to see, oh, we are getting the insights, but can we automate it? Can it handle the calls? That's how it started.
Understand. So a lot of dental practice owners and DSO operators here, AI replaces your front desk staff, and their first instinct is skepticism or resistance. How do you have that conversation? What does it actually take to earn trust with the buyer?
Sure. I mean, that's why we start to say like we are providing an agent that's going to assist you with the operations. But the definition of assistance would tell you that it is going to help you, not replace you, right? That's kind of the framing that we look at it. And also, it's not possible to automate 100% of the work that is done by an office manager or receptionist. They do a ton of work. Other than just doing the scheduling and onboarding and checking things.
Right.
Of course, we can take off the burdens quite a bit. We can automate it, all the manual process we can take it, and they can have a human interactions, which is not possible yet by the AI,
Right.
And we still don't want it, that
Right.
interaction to be AI. So yeah,
I was going to say, I think people still want a little bit of human interaction. People still enjoy that.
Yeah. I mean, one another parallel that I would draw is, imagine you have a self-driving car, right? Initially, it used to be like a lane keep assist. Then it is started to detect the lights, right, the intersections. Now it can handle like only highways, like lane changes it can handle. Then it can go into regular streets and drive it. It is similar to that. We can't yet sleep in the car and go. It can drive the certain routes. Similarly, the workflows are like that. If you're driving let's say a dental clinic, you might have a lot of operations that are possible to automate it. Some are easier, like scheduling is probably something to get it first. And then you have a lot of other workflows like insurance verification to the claim management, things like that is the other workflows that you get to. But can we completely run your clinic just on the AI, like without having anyone? We're not there yet, and maybe we don't need it at that point. But the whole idea is to like, how do we make it easy to run a clinic?
Yeah, excellent. Thank you. So 2 things on your platform stood out to me: the custom instruction engine and operatory aware scheduling. Those are specific enough that they didn't come from a whiteboard. What problems were you watching practices struggle with that made those features non-negotiable?
I mean, you pointed out a very good thing, how holistically we think about this, like how deep we think about this. When we say we are not just a chatbot, we're not just a scheduling system, right? Because when we started to roll out, we just made like a very generic system, how to like, hey, we're going to pick this operatory and these are the appointment types we support. When the patient calls in, we book, right? And we started to roll out and we realized every clinic is run by different office managers,
Right.
and they have their own preferences. So that's where it hit us that we need to adapt the technology to them, not change the way they are running the operations. They've been doing this for 20 years, 30 years. I want the AI to adapt to them. Then we start to realize how do we teach the AI or provide that knowledge of customizations without having an IT background. Like office managers would want a very simpler way, like set the way they wanted, and we want to help that way. That's why we configure the AI such a way that it understands and very customizable, and it understands operatories, it understands providers, and which provider is assigned to which operatory, and what kind of appointments are supported, and where to book, where not to book, and how to look at the treatment plan and manage it. So that is how it kind of gets. And also there is a lot of like knowledge based rules that we get from the operational manager. I wanted it this way, these procedures would go into this. Ideally we wanted these operatories to be used for that. So we actually like move around it and provide an assistance. That's why our AI like sets apart from the others, where we can just configure it to their needs so that the AI adapts to them instead of office managers adapting to the AI.
I understand. So the show is called The Care Shift because we believe there's a real rebalancing happening where the administrative burden gets lifted off healthcare workers so they can actually focus on care. From where you sit, deploying this data is at scale. What does the shift look like over the next 3 to 5 years, would you say?
I would say a lot of things would change. I would say change is inevitable in terms of how they run it, but also few things remain constant, right? You're still handling those operations, but with a much better assistant that is going to run these things smoothly. You still need a supervisor or someone who needs to approve these workflows. And that's how we're imagining 3 years down the lane. The basic manual things get handed off to AI where it is good at, whereas you kind of worry about the other set of the problems that is really focusing on the patient getting access to the care, and how do you run it in an efficient way and a profitable manner.
Understand. So TensorLinks is clearly built for dental and DSOs right now, but the infrastructure you're describing, the agentic layer, the 1 million plus token context window, the multi-location rules engine, that architecture applies way beyond dental. Where does this go?
Yeah, again, we have to start somewhere. And as I said, I was introduced to the dental clinic owner or a DSO, small DSO, where we are able to like prove and bring a transformation to the operations, how we are doing it. Again, our workflows are same for every business, right? But also you can't just spread too thin. You have to understand enough so that you can make an impact. And we started in dental, but our agentic layer is generic enough that can make an impact to the other verticals like outpatients and the ophthalmology and things like that. Any ology kind of clinics would fit into it. Over the time, we are focused on healthcare because that is the fragmentation and the unification that we want. The healthcare market is fragmented in terms of the APIs and also which systems to access what knowledge base, and we want this agentic layer would bring the unification to it. So whichever vertical we touch, we are going to bring more of unification to that.
Great. Thank you for that. So, Sridhar, could you just really quick, this was generally valuable. Thank you for the specificity you brought to this and for being so open about thinking behind the product. I really do appreciate it. Could you just let everybody know, your handles, where can we find you at?
Do you want me to explore like 2 years from the lane or 5 years from the lane, or just like where can they reach me?
Like your website.
Yeah, sure. Yeah, sure. I mean, you can easily find us on TensorLinks.com. You can book us a live demo, or I'm available on LinkedIn. Just search for Sridhar Uyyala and connect me on LinkedIn.
Excellent.
Or just send me an email to sridhar@tensorlinks.com.
Excellent, excellent. Thank you very much for that.